I'm fine. How are you?
Great, great.
Good evening, Ashish.
Hello. Sir, good evening, Dr. Virmani.
Ashish.
हाँ जी sir.
Good evening. Good evening. How are you?
I am fine. Rai sir, very good evening to you.
Good evening, good evening. कैसे हैं? ठीक है?
मैं ठीक हूँ सर, आप बताइए, बड़े बड़े दिनों बाद दर्शन हुए आपके।
हाँ
मैं एक्चुअली सर अभी थोड़ा सा ट्रैवल कर रहा था, बट
अच्छा।
इसलिए मैंने अपने स्लाइडें अभिषेक को दे दी हैं, तो ही शेयर इट।
Yes, sir. Slide will be displayed from our side.
दरिया साहब नमस्कार, कैसे हैं?
Welcome, Dr. Daria.
बढ़िया सर.
Daria Saab is back from Amsterdam just now.
Yes,
Hello,
not
sir.
just now, sir. I back on
Congratulations.
Sunday evening.
Sir, he is looking fresh. I do not know why.
Yes, I am always fresh with Dr. Ashish once we are together. Huh?
अरे इंटरनेशनल स्पीकर बन गया है.
हाँ सर, हाँ ये बात तो है सर.
नहीं सर, आप लोगों की ब्लेसिंग्स है. अभी तो आईडीएफ जाना है बस. वापस आईडीएफ बस सर. बढ़िया आईडीएफ जाना है 4 तारीख को.
डॉक्टर लोहानी वेलकम सर, गुड इवनिंग.
प्लीज जा रहे हैं.
गुड इवनिंग. हाँ, तुम जा रहा हूँ.
Virmani sir, should we start?
I think
I think speaker is
if we can
the
start
speaker is ready.
1 minute after 1 minute.
Okay, sir.
After 1 minute we can start. It's 9:04. आपका एजेंडा तो वही है ना अभिषेक?
Yes, sir.
Okay. Dr. Vitul, you can distribute your book in the cruise.
सर मैं 5-6 तो लेके आऊंगा, ज्यादा वो बुक इज अबाउट ½ kg बुक. हाँ तो बहुत मुश्किल है. हाँ
ठीक
तो मुश्किल हो जाएगा.
कुछ ले आइए, दे दीजिए, बाकी नेक्स्ट टाइम देखा जाएगा.
नहीं सर,
कोई बात नहीं, जितने ला सकते हैं लाइए.
सर आप एक ना वहाँ पे अनवील कर देना और 2-4 ले आना, बाकियों को आप यहाँ से बाय पोस्ट भेज दीजिए.
नहीं, मैं सबको मैसेज कर रहा हूँ कि सेंड मी द पोस्टल एड्रेस एंड फोन नंबर. आई हैव ऑलरेडी सेंट 150 बुक्स.
गुड सर, मेरे को मिल गई सर, मेरे को मिल गई.
वेलकम डॉक्टर मितिंजय.
गुड इवनिंग सर. गुड इवनिंग.
गुड इवनिंग डॉक्टर मितंजय, कैसे हैं?
हाँ ठीक है सर, बहुत अच्छे. आप कैसे हैं? गुड इवनिंग सर.
So I am already asking to send me the postal address. I am dispatching the book by post.
Yeah. I've got that mail.
I've already sent my postal address to you, Dr. Gupta.
It is being dispatched. आज तक मेरे को जो एड्रेस मिले थे वो कल को डिस्पैच हो जाएंगे सारे.
Very good.
नहीं, but I wanted it from your hands, personally autographed.
So yes, I am taking 4 or 5 books with everywhere I go.
Yeah.
So I will be bringing 6-7 books on cruise also and to Prulia also.
Okay. अब तो हो जाएगा, अब कवर हो जाएगा.
Sir, kindly keep one for me.
हाँ जी.
We'll meet at Kodia. Kindly keep one for me, sir.
Yes. I am bringing all the 6 for you. You can distribute it according to your.
Oh, thank you.
तो सेक्रेटरी साहब को हम दे देंगे, जो आगे देना होगा वो सेक्रेटरी साहब का इशू है. डॉक्टर
जी.
अभिषेक
now start, I think now.
Sir. Yes, sir. We are going to start. Good evening to all respected seniors and my dear colleagues. Anand, you can record it now.
Yes, sir.
Okay. So first of all,
already started.
First of all, I welcome our founder president, Professor A.N. Raya, sir, Dean of ICCMD, Dr. Anil Virmani, sir, senior faculty member, Professor K.K. Lohani, sir, Professor Vitul Gupta, sir, speaker of today's session, Dr. Ashish, sir, seniors of CCDSI, and dear colleagues. As we are doing this session under the Dean's CME, we have come across a slightly lower discussed topic, that is the noise pollution. Usually in conferences, we do not discuss such type of topics. So when I got opportunity from Dr. Ashish sir that he wants to talk on this topic, I was very excited. So I hope that we are going to learn much more about this noise pollution and noise stress relationship. And many papers are now coming up with its relation to mental illness or cardiovascular illness. I hope that after the CME, we will be more wise in this subject on this topic. So proceed with, I request Anand ji to start the proceeding with Saraswati Vandana.
कुन्देन्दु तुषारहारधवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्करप्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा शुक्लां ब्रह्मविचारसारपरमा आद्यां जगद्व्यापिनीं वीणा पुस्तकधारिणीम् अभयदा जाड्यान्धकारापहा हस्ते स्फाटिकमालिकां विदधतीं पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदाम्।
Thank you, Anand ji. May I request our founder president, Professor A.N. Raya sir, to give us blessings so we can start with this new CME, the other addition in our feather.
Thank you, Abhishek. I think I must thank Dr. Virmani for regular CME under his dean office. Today's CME is really unusual topic, and we are all unaware what it is. Noise pollution is going to have effect on our body, and I'm glad Dr. Ashish Saxena is going to speak on this topic, and we will all benefited. I thank every member who have joined today, because those who have not joined will miss the talk. This is not a common talk. This is an uncommon talk, and we learn always this type of talk under the CME. So with these few words, I thank again Dr. Virmani for running the CME. Thank you.
Thank you, sir. Now I request the Dean of ICCMD, Dr. Anil Kumar Virmani, sir. So, sir, please give the initial look of this topic so we can start up with.
Good evening to all of you. At the outset, my gratitude to our founder president, Professor A.N. Rai, for always blessing and guiding me. Dr. Abhishek, who has been the mastermind behind all these CMEs, and he has done a lot for this organizing the CMEs. And today's topic, especially when he told me that Dr. Ashish has agreed to talk on noise pollution, I was also very excited because I know Ashish is a very good friend of mine. He's a very soft-spoken person. So I was thinking that perhaps he's suffered a lot from noise pollution and he wants to talk on that. And we all know we tend to ignore this very common thing. You see, noise pollution is there in our lives day in, day out, whether it's the noise of the TV, radio, or even the fan that causes the noise. Even in my bedroom, I can hear the noise of my fan. Or you go out, loudspeakers, traffic, and whatnot. And the noise, we know the side effects of noise, varying from simple hearing loss to cognitive defects to memory loss to cardiovascular disease and so on. I mean, that Ashish, of course, will be able to tell us much better way. And I'm sure he'll also stress on how to reduce noise pollution and what government regulatory regulations can come to enforce such things, especially during the night, especially for elderly people, so that they can sleep properly. I've been trying that every alternate month along with Dr. Lohani that we have our CMEs regularly. The next CME, of course, April, there are going to be two CMEs now. One Dr. Lohani's, one mine on the cruise. So that I'll skip June and then I'll go straight in July. And then we have in August our annual conference. With these few words, I'll pass on the baton to Abhishek to invite our president, Dr. Madhukar, if he has joined.
Madhukar Rai, sir, I'm not seeing, sir.
Okay, anyway,
Probably.
then I think
Yes,
the chairperson.
we can proceed with the invitation of chairpersons. We have two chairpersons today.
Yeah,
Dr. K.K. Lohani, sir. Sir is the professor and head of Department of Medicine in NSMCS, Patna. And Professor Dr. Vitul Gupta, sir. We all know that he is a doyen in working with the social segments and in pollution. We are talking about his book just now. So may I invite the chairperson, sir, Professor Lohani, sir, may I start this session, and then you both are very expert to conduct this session. So session is handed over to chairperson, sir.
Thank you, Abhishek, for kind introduction. Good evening, everybody. Once again, on behalf of CCDSI and ICCMD, I welcome you all in today's scientific session. As you all know, every month, either under the banner of CCDSI or ICCMD, we organize regular CME to update the knowledge of our members. And today we are going to discuss a very unusual topic, as already pointed out by Dr. Professor A.N. Rai, noise and stress. We have known for quite some time that noise causes defect in internal ear and causes hearing loss. We also know that it is a cause of sleep disturbances. It is a cause of anxiety, depression, abnormal behavior, and even suicidal tendency. Sometimes it becomes a reason for social conflict also, excess noise at wrong places. But what we were not knowing that excess of noise can cause hypertension, can increase heart rate, can cause cardiovascular disease. And now evidences are gathering in the favor of noise affecting our cardiometabolic profile. We have with us a very learned speaker to discuss all these things in detail. But before that, I will invite our co-chairperson, who is a versatile physician, a very good academician, and keen interest in social service and especially pollution. Yes, I'm talking about Dr. Vitul Gupta. So I request Dr. Vitul Gupta to introduce the topic and to introduce the speaker and then invite him for the deliberation. Thank you.
Thank you, Dr. Lohani, for kind words. So basically, Ashish doesn't need any introduction. He is one person who is loved by everyone as academician, as a personality as such. But for noise pollution, I must tell you that all the other pollutions have got different aspects that people don't enjoy. But noise pollution is one pollution where most of the people enjoy. You go to a marriage party, if you ask someone to decrease the volume of DJ, everybody is up against you कि यार मजा नहीं आता है थोड़ी आवाज में. So Dr. Ashish will make us aware that we should go and speak against noise pollution wherever we can. So we invite Dr. Ashish to make us aware about the adverse health effects of noise, increased noise or noise pollution. Dr. Ashish, please.
Very good evening, everybody, and Dr. Rai, Dr. Vermani, Dr. Lohani, Dr. Vitul, dear friend Abhishek, Mrityunjay, and everybody of CCDSI. It's really a pleasure to talk on this topic. I am known to keep talking on certain topics which are almost out of the box, and I somehow try to relate them to day-to-day diabetic and cardiac patients. I remember one of my friends. I was just discussing certain things with her, and she said कि तुम्हारे साथ तो ये है कि तुम कोई भी चीज ना हार्ट डिजीज के साथ और शुगर के साथ जोड़ देते हो. You have an expertise. So we were just discussing about this noise pollution. Basically, according to the European Society of Cardiology, we have a noise stress concept, and there is a need to assess the risk. And there are certain research needs, and there are certain things which we have to bring up to the notice to the local authorities, to the government of India, how we can make our population much better. Now, when we go to the hills, we feel so comfortable because what we hear is the humming sounds of the birds. We hear the whistling sounds of the woods, and there's so much of peace because there's no more of noise. Recently, if you see, Dr. Daria has visited Amsterdam, and he'll definitely appreciate. There is no noise pollution over there. It's a calm city. It's a beautiful place to go, a place to visit. So these people are far ahead of what we have. We have so much of noise which is coming from almost all quarters. I'm not talking about the vehicular noise. I'm talking about the noise which happens in the house. Some of our fans might not be better, and they keep giving a noise, and we keep listening to it. Some of the other machinery is not good, and we keep listening to it. And what is the effect that is going to cause? We'll be discussing. My slides will be shared by Dr. Abhishek as he's doing. So we go on to the next slide and discuss about this topic. The flow of presentation will be like we'll be talking about the noise pollution which is affecting all parts of our country, the impact of long-term exposure to environmental noise, the dose-response relationship for noise and cardiovascular disease, the road traffic, blood pressure, hypertension, relation of noise to stroke and CVD, risk evaluation, how do we proceed, solutions and research needs and policy interventions. When we look to the next slide, now one thing we have to realize that there is a permissible limit for noise. Everything has got a limit. The permissible limit laid down for different areas, for different zone, both during the daytime and the night time is different. For an industrial area, it might be 75 decibel during the day and 70 at night. For commercial areas like a mall or a cinema or a market, it might be between 65 in the morning and 55 at night. And in residential area, it is further less, 55 in the morning and 45 at night. So this is the limit which we need to understand. When we come to the next slide, there are various sound sources, and these are the various decibel limits. Now, when we whisper at 20 decibels. A peaceful landscape, which I was talking about the hills, is somewhere around 30 decibel. In our living room, where it is quiet, it is about 40 decibel. The normal conversation which we have is around 60. The sound of the car is around 70 decibels. A medium-sized truck is 80. A large is 90. A jackhammer where there is a construction going on is around 100. Now, Dr. Vitul has pointed out about DJs. The rock concert is somewhere around 110, which just shoots off the brain. The aircraft takeover is around 120 decibels. And the pain barrier where it can cause pain is around 130 decibels. So if you are enjoying a rock concert at 110, the required is around 60, so you're already 50 decibel high. And that is why after a rock concert, when you come back, you experience the dizziness, the tingling sensation, the tinnitus. And sometimes a lot of people start complaining of vomiting. So a lot of people start complaining of nausea. And these are the people who land up sometimes, elderly population land up sometimes in the OPD with tachycardia. I have seen patients after a concert coming and having myocardial infarction because they have tachycardia and they have PSVT. Next slide, please. So look to this Moradabad junction. This turns out to be the highest populated, noise polluted city of our country. And after Moradabad, we have Kolkata, Asansol, Jaipur, and Delhi. Moradabad being an industrial city, the normal decibel is more than 114. So this is something very alarming when I had went to look into the various details. Next slide, please. So what is the impact? You just imagine this gentleman standing, and it is we who are standing to the rock concert, to the cars, to the industries, to the aircraft noise, and to the loudspeakers, to the arzan, to the mandirs and the masjids and everywhere. We are actually having 12,000 premature deaths every year. 48,000 new cases of ischemic heart disease per year is seen in the European territory. India has got no data about it. About 22 million people suffer chronic high annoyance. We see that people are irritated. That is because they are coming from a noisy environment. And 6.5 billion people suffer from chronic high sleep disturbance. They're not able to sleep. And the best part is nowadays we have got TV in our rooms, and in the TV we are watching some or the other music. We are watching some or the other movie, and in the movie, apart from the light fluctuation, there's a noise fluctuation. There might be a war movie which might be showing something. There might be some other type of a movie which might be showing sometimes high volumes and low volumes. So that is what we are creating a disturbance for our sleep. Have we ever realized this? Next slide, please. I'll be talking about the cardiovascular effect, the long-term and the short-term environmental noise, which leads to stress reaction. A noise annoyance, the annoyance of noise, that reaction, causing a disturbance of sleep. Now, as rightly said, after disturbance of sleep, patients gets emotionally restless. He has cognitive dysfunction, affects the autonomic sympathetic system, the endocrine organs. There is high level of catecholamines and cortisols, which result to changes in the lipid metabolism. Now we have dyslipidemia. We have got endothelial dysfunction. We have got blood glucose metabolism, which is changing. We have got blood pressure regulation and increased risk of cardiovascular illness. Now, just imagine right from slide 1, where we continue, we have long-term and short-term complications, and it is ultimately landing up to cardiovascular disease. Next slide, please. This is the noise effect model. Persistent and acute exposure to noise leads to cardiovascular disorders by raised blood pressure, lipids, sugars, increase in cardiac output, tachycardia, increasing in the blood viscosity, activating the blood coagulation profile by mental and psychological stress reactions. And in long term, this leads in turn to clinical manifestations of CVD such as hypertension, arrhythmias, heart failures, CVDs, and stroke. So this is a vicious cycle which keeps going on. Let us look to the next slide. Now, there is actually a dose responsive relationship of noise and cardiovascular disease. The less noise, less exposure, less is the dose, more noise, more exposure. It is weight, day, evening, and night sound levels. Now, with the increment of 5 decibels for the evening and 10 decibels for the night, cardiovascular disease, hypertension, all increases. If you look to the graph and the various, the blue line is the aircraft cardiovascular disease. The noise level from 48 decibel, which goes up to 70 to 72 decibel. Similarly, when we have a road traffic, it causes cardiovascular disorder because the noise level goes from 48, 52 decibel to almost 78 decibel. And similarly, the aircraft height, the flying of aircrafts, it increases up to 70 decibels, which goes beyond the normal thing for tolerance. Let us look to the next slide. Now, cardiovascular effects on nocturnal noise. We have endothelial dysfunction. As the noise increases, there is endothelial dysfunction which increases. The stress hormone level increases from noise 30 to noise 60, which is the playback aircraft noise events. Next slide, please. Now, did somebody wonder why in Heathrow there are no flights going in the night? Because there was a complaint that people all across Heathrow were losing their sleep because of the flights landing in the night. So ultimately, there is a ban of any flights landing down in the airport during the night, and that is what happens all across Europe. Most of the aircrafts are not landing during the night. So transportation noise increases the um, coronary artery disease risk. It increases the risk of cardiovascular disorder and stroke, which involves arterial inflammation. There is swelling. And how do we check this swelling? We check the HSCRP levels. If it is more than 5, definitely the patient is suffering from it. And this swelling has to be tackled in a very efficient way. Next slide, please. Road traffic, blood pressure, and hypertension. This was a meta-analysis about 24 cross-sectional studies, relationship between road traffic noise and prevalence of hypertension, which was quite significant. Like per 10 decibel increase of a 16-day hour average road traffic accident noise causes more of hypertension. Similarly, an increase in systolic blood pressure has been seen, stronger and significant association in men and older children. So now, dear friends, we need to ask when we have a patient who has got tachycardia, we need to ask the patient who has got a little bit of rise in the lipid level and the rise in the blood sugar levels, that what is the environment is he staying in. Next slide, please. Noise and coronary artery disease. There is no direct evidence linking noise to coronary artery disease, but many studies linked with congestive heart disease risk factors like hypertension, indirect relationship between noise and CVD. The meta-analysis of 4 cohort and 1 case control study between road traffic and incidence of hypertension reported this type, that noise actually leads to hypertension and coronary heart disease. Next slide, please. Yes, stroke is very, very common. High exposure to noise can cause stroke, especially for our elderly population who are hard of hearing. They experiences these type of problems more often. Next slide, please. Aircraft noise. Several studies within the last 10 years demonstrate a higher prevalence of annoyance, cardiovascular disease, or medication intake in persons exposed to aircraft noise. So this is why we are having most of the aircrafts out of the city, so that the population commonly is not affected. Next slide, please. So now we come to the main thing. We need to evaluate the risk. We look to the exposure assessment. We look to the dose. We look to the attributable risk concept, and then we come down to measurement and relaxation. The process of risk evaluation comprises of hazard identification. What is the hazard? That jackhammer is an hazard. So why not reduce it by to the population who are working on a jackhammer with some ear plugs which can cap down the noise. Exposure assessment. How are you affected? For our cardiac patients, for our patients who have got low ejection fraction, we tell them to avoid to go to a party, or if they are going to a party, please do not go near to the DJ. If you look to the DJ, if you stand close to the DJ at a very high volume, you can see the impact of the air coming out of that those sound boxes. And so how much of problematic it is for a patient of cardiovascular disorder. So this is thing we have to tell them, that please don't go near to that, or you enjoy the party, but don't go near to that hall. This information is summarized in and called the risk characterization. involving interpretation of available evidences, data, scientific discipline, and discussion. Next slide, please. So the risk evaluation process counts. As a result of evaluation, an estimate of likelihood hazard. It is not only silicosis, which was one time a hazardous thing. It is not pneumoconiosis only. With the advent of this new era, noise pollution has also become greatly important for exposure. This is this will serve the key information for any risk management and regulatory options. When we look to the next slide, this is the daily exposure for each task. Now you can see over here, I can circulate this also to everybody. Below low exposure and the total number of hours, it actually points, and the number of points which add up, that actually tells us about the exposure. This is a ready reckoner. We can have it down on the internet also. And this gives an assessment. We add up the points of each task over a period to give the total exposure. Suppose somebody is sitting in a quiet room, then he goes to a construction site, or he's having in a quiet room, there is a fan which is not working properly, there is some noise coming, or there is a TV which is on a higher volume. All these things are actually creating problems, and this dose can be cumulatively calculated. The exposure can be calculated. It is diligently but intelligently done. Next slide, please. So what are the solutions? Solution is elimination, physically removing the hazard. Now, what if elimination is not possible? Replace the hazard, that is the substitution. If not substitution, let us come to the engineering controls, isolate people from that hazard. Administrative control, change the way of work, and protect the worker with personal protective equipment. So, this inverted pyramid actually helps in reducing the noise. So, please identify at your areas what is happening. Next, please. Buy quiet place, actions to reduce noise at workplace. Occupational safety and health professionals, employees, employers are all working. How do we buy quiet, select and purchase low noise tools and machineries, maintain tools and equipment routinely like lubrication, gears. If you just realize we have got our echo machines, and the echo machines, they got a fan, and that fan keeps making a lot of noise. We need to reduce that also. Reduce vibrations wherever possible. Isolate the noise source in an isolated room or enclosure. Place a barrier between the noise source and the employee, and isolate the employee from the source in the room or booth such as sound wall or windows. We have got lots and lots of works in the industry. We can have soundproof rooms. So let us buy quietness. Next slide, please. These are the WHO guidelines for an outdoor living. Total 16 hours standard, 50 to 55 decibel. For dwelling indoors inside the bedroom, around 35 to 40. For classroom, it is around 35. For playground, it's 55. Hospitals is 30. And as low as possible in the indoors. But when it comes to ceremonies and festival, it goes up to 100, but you should not exceed that. Public addresses around 85. So these are the various limits which has been set up by the WHO. And these are the exposures which we need to calculate. Next, please. Research, yes. The researchers did not attempt to account for demographic, socio-economic, or other health risks in this analysis, and they suggest further research should help to identify these type of things. We have a lot of our doctors, especially from our place, who are actually working on these type of things, which is actually creating awareness to the government. As a next stage, the team plans to examine the data in more detail for insights into the source of transportation noise may have a greater impact. Next slide, please. Policies should help, they do help reduce an individual's exposure to transportation noise at home, even in urban areas. Example includes enforcement of noise ordinances, infrastructure to block road noise, rules for air traffic, low noise tires for vehicles, better noise insulation for buildings. These things can be done right from the start. We can do these things. Next slide, please. So in the end, I'll summarize. Many cities in our country have recorded alarming levels of noise pollution. Long-term exposure can cause 48,000 new cases of ischemic heart disease in a year, 12,000 premature deaths. Persistent exposure and acute exposure to noise leads to the development of cardiovascular risk diseases by mental and physiological stress reactions. Research is definitely needed in this field. This is a less studied field, but like type 2 diabetes and pre-diabetes, we are having this thing also, and very soon it will be one of the most important topic which we'll be discussing. Policy intervention is very, very important. Local policies are very, very important. So this is all I like to say. Thank you all for your patient listening.
Thank you, Dr. Saxena, for a very informative and very scientific talk. You have explained everything with proper evidences in support of your lecture. There are two things I would like you to comment on. Number one, how to manage the noise pollution in our working places like hospital, nursing home, and clinic. And number two, how to tackle the noise pollution because of mobile phone. The whole day we are in living relation with mobile phone. So what is the impact of these two things in our health and how
Sir,
to tackle it?
sir, it's a very important thing. Detoxification from the mobile phones, which is very, very important nowadays, because constant talking. Now, another thing, if you notice, um, these kids, they actually have a earphone plugged onto their ears, and that is direct noise going into their ears. This is again very dangerous thing which is happening. And what is happening, the levels of noise is increasing so much that ultimately they are talking sometimes weird. So these things have to be discouraged. Our prescription should include that we should avoid noise as best as possible. Now, very important thing, what I have noticed in our hospitals, there is a lot of movement in our hospitals. So for our staff, we can give them certain slippers which actually can reduce the noise of walking. Similarly, the beds, the chairs, they can have certain rubbers down which are almost worn out because of time, or the greasing of the wheels have to be done properly. The wheelchairs have to be properly managed so that they don't create a noise. If you see that squeaky noise keeps on coming whenever something moves. So these things have to be tackled in our working areas. Apart from that, certain areas where we have got an ultrasound room or a TMT room or we have got an X-ray room, they have to be secluded and there should be a barrier so that the noise can be left inside. So we need to work on this. We have got our hospitals, some are new, some are old, some are almost on a middle thing. So we need to introduce these things in our own settings. Now there are certain things like we have got, I was talking about the fans, because what I noticed that in my room, the fan creates the maximum noise, and there is no fan which has got a less noise. The moment the fan is on in the bedroom, the noise level of the TV starts coming down, and we have to increase the level of the TV. So this is indirectly. So at least switch on the AC, or we need to certain those type of fans which have less noise. Especially those smaller fans, they create a lot of noise, and these things we don't realize because ultimately we get irritated. So these are the things where we need to work out slow by slow, pen by pen, work by work, brick by brick.
Thank you, Dr. Saxena. Honestly speaking, when I came to know that you are going to talk about noise and stress in a meeting of Clinical Cardiodiabetic Society of India, in the beginning, I thought that both these things are pull apart. But you have proved that what you talk is very much part of cardiodiabetology and metabolic disorders. So thank you. I request Dr. Vital Gupta to invite questions and to conclude the talk.
Dr. Ashish, congratulations for making this a rather complex subject very simple.
Thank
And
you.
I think most important is awareness, that we need to make people aware that noise pollution is adversely affecting our health. Different
Yes.
aspects of health are being affected. So basically, if you go to some ICU, it should be the quietest possible area. But you will find all the staff nurses, speaking at their high pitch, calling from the fourth bed. So creating noise pollution in a ICU is much more dangerous than otherwise. So basically, people enjoy. You will find noise pollution of different type in railway platforms or in buses where people don't use their earphones. They have, their mobile phones at high pitch, listening to some movie or some song. So I think awareness is key, and policy also. Policy, if we, like Dr. Ashish have told us that there are various noise pollution ordinances, but their implementation, enforcement by the law agencies is very, very poor. So I remember in my house, adjacent is a mandir. So during some function, they have high pitch loudspeakers. And if you complain to Deputy Commissioner or Police Thana, they are going to tell you, Doctor Sahab, छोड़ो जी, 2 घंटे की बात है, issue create हो जाएगा. But that is, you go to Chandigarh, they enforce it very strictly. So all the functions are closed by 11 p.m. at night, and orchestra, the voice is according to the WHO guidelines. If it is high, the police comes and reduce it. So two things: enforcement of the law and awareness for general people is most important thing to decrease noise pollution in particular. Rest, sometimes it is not in our hands, but noise pollution is one thing. If we stop enjoying high noise, we will be better, in a better shape of health also. Thank you, Dr. Ashish, for a great talk.
Thank you, sir. Thank you so much.
Doctor, with the permission of chairpersons, can I make a comment?
Yes,
Sure.
definitely.
Dr. Vitul,
Sure.
at the outset, Dr. Ashish, I think that was an excellent talk, so well elucidated on a very on a topic which hardly people know anything about.
Yes.
And you have very nicely told us the various side effects and how to reduce. And the two comments that Dr. Vitul said, awareness and regulation by the authorities, I think they are the only answer that we should have. Today, I know when I was in US one day and we were having a party in our son's house, there came a phone call from the police that I've got a complaint from your neighbors that you're making too much of noise. And we were just laughing and dancing. That's all. There was no music. So you can imagine how sensitive they are to
Definitely.
noise in US and how regulations are very strict. But as Vitul very nicely said, that in India, there's loudspeakers are there outside my house, and you tell the police, they said, no, forget it. It's question of 2 3 hours. We can't do anything. Nobody bothers. So you need to have very strict regulations, and definitely we are becoming aware because now we are seeing silent airports. You go to some airports and it's written this is a silent airport. No announcement will be made.
Yes.
So at least some awareness is coming. There is no doubt about it. And of course, hospitals everywhere is written, please be silent, please be silent. I know human beings have a tendency to talk a lot, just like I'm doing. So I'll not talk too much. But then, yes, it is very important to stop noise pollution. Over to you, Chairperson.
So any
If
other
anybody
comment
has
or question?
any query or any comment, most welcome. May I request Dr. Roy, sir, to say something on this topic? Yes,
Dr. Lani,
welcome.
I must congratulate Dr. Saxena for the excellent talk. I think we have been all benefited today. Most of us were not aware of so much cardiovascular effect or other metabolic effect of this noise pollution. But everybody we knew that noise pollution causes stress, and stress can lead to anything. So stress, insomnia, then stimulation of the autonomic nervous system, and that causes increase the heart rate, increase blood pressure, in the long run, dyslipidemia, other things, and this endothelial dysfunction. All these things are consequence of the prolonged noise pollution. So, best thing is to avoid But as Dr. Pitul has said, Dr. and Dr. Bimani, we live in a society where nobody listens. So we have to isolate ourselves if we want to prevent. And the only way is to have a regulation which regulation is, even if the regulation is there, it is not being followed. Dr. Pitul said Chandigarh is followed, but most of the places, police said, oh, एक दो घंटा के लिए तो है क्या कहाँ कोई करे. So these are the problem. I think we must enforce the regulation, and we must avoid, especially those persons who are having cardiovascular, they should avoid. So with these few words, I once again thank Dr. Ashish Saxena for excellent talk. Thank you, Dr. Lani.
We have with us Dr. D.P. Khaitan, the past president and past team. Is a very spiritual person. I'm sure he will give some insight on this issue.
This noise pollution to me seems a nuisance to the cardiovascular system as well as metabolic system, both. Any sort of stress, including noise pollution, may cause the hypersympathetic activity, causing the stress to the already strained heart in the form of the cardiovascular disorders and metabolic insults. By raising the heart rate, by stimulating the heightened blood pressure more, and plus also disturbing the normal sleep at night. All these will lead to definitely deterioration of the cardiovascular system already the patient is suffering from. That's my view. Thank you, Dr. Lani.
Thank you, sir. And it's time to hand over the mic to Dr. Abhishek to conduct the rest of the session, and ultimately to Dr. Mrityunjay for vote of thanks.
Thank you, sir. First of all, I congratulate Ashish sir for excellent talk, and I must admit and thank all three faculty members from my side that on the short notice of only 2 days, I think sir was ready to deliver this talk. Probably we were going to miss this month, but somehow we conducted it, and it is one of the most important topic in our practical life. When I put this time from 9 p.m. onwards, Dr. Lohani sir asked me why so late. So answer is there in the slide of Dr. Ashish. नॉइज पोल्यूशन पे सर हम लोग जब नॉइज शहर का खत्म हो गया तब हमने इस पे बात की है आज. Ashish sir, you have some other engagement from 9:30. You will be with us. Thank you, sir. Thanks a lot. Now I invite Dr. Mrityunjay sir for vote of thanks.
So, good evening to all of you. जहाँ तक नॉइज पोल्यूशन की बात है तो ये आम पब्लिक के लिए तो है ही नहीं, इवन ब्यूरोक्रेसी जुडिशियरी हो या सरकार के लेवल पे भी हो, नॉइज पोल्यूशन को लोग पोल्यूशन मानते ही नहीं है. तो थैंक यू वेरी मच डॉक्टर आशीष सर फॉर डिस्कसिंग very uncommon topic, and our forum is known for this, and I will request our dean sir to keep these kind of topics in future academics of ICCMD. So thank you to all of you for coming, for joining us. Thank you, sir. Thank you to all of you. Thank you.
Thank you, everybody. I think
good night, everybody.
Good night.
Yeah.
Good night.
Good night, sir. Good night.
Good
Good night,
night, sir.
everybody.
Thank you, sir.
Take care.
Thank you.
We'll meet
And
very
after-
soon in Purnia.
Yes, sir.
Yes, sure.
Yes.
And in May, we will have next CME under the banner of CCDSI. In April, we will be having the CME on
Right.
the cruise. So May from CCDSI side.
Oh.
Date will be announced in time.
Okay.
Thank you,
All the
everybody,
best.
and good night.
All the
Good night,
best.
everybody.
Sir, pranam sir, sabko pranam.
Pranam, pranam.
Ram sir, thank you so much. Thank you.
Thank you.